The Presidential Task Force on COVID-19 says 8,000 people have been vaccinated so far in 35 states and the FCT. Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib, stated this at the PTF briefing in Abuja. He, however, disclosed that Kogi State was yet to receive vaccines because its cold chains for preservation of the vaccines were under repair.
All state governors, apart from Kogi, have launched the vaccination program in their states. As you must have seen on the media, these launches also involved public vaccination of the governor and strategic leaders, again to underscore the confidence in the safety and effectiveness of the vaccine. As part of the vaccine launch in the states that occurred last week, over 8,000 Nigerians have been administered the vaccine thus far. We have not received any official report of serious adverse events from any of those who have been vaccinated. Of course, mild side effects such as pain and swelling at the site of the vaccination are expected. This is normal with any vaccination, and we are working closely with NAFDAC to monitor any unusual adverse reactions to the vaccines. I want to assure Nigerians that the federal government, through the Presidential Task Force on COVID-19, is firmly committed to safe and successful COVID-19 vaccination in the country. No safety and efficacy standards has been compromised in the decision of the government to introduce the Oxford AstraZeneca COVID-19 vaccine. The vaccine was approved for emergency use listing by the World Health Organization and was tested and certified as safe and effective for use in Nigeria by NAFDAC. Our cold chain stores are very efficient and powered to ensure that optimal temperatures are maintained in the distribution of this vaccine to the states and LGAs throughout the country. It is important to note that none of the approved brands of COVID-19 vaccine is inferior. Understandably, the Oxford AstraZeneca vaccine costs relatively less than the other available brands of COVID-19 vaccines. However, this is not because it is inferior. It is because AstraZeneca, which partnered with Oxford to produce the vaccine, decided and announced that they will not be making profit during this pandemic. So from a humanitarian point of view, they decided that they will sell at their cost price. This is the reason for the relatively low cost of the AstraZeneca vaccine. It is not because it is inferior in any way. As you very well know, the AstraZeneca vaccine is being used in many parts of the world. Even after the rollout suspension by some European countries over certain concerns raised, the World Health Organization and its Vaccine Advisory Committee has advised that there is no reason to stop using the Oxford AstraZeneca vaccine. Similarly, the UK's regulator has also determined that evidence does not suggest that the vaccine causes blood clots.